Do you have these 7 scoliosis symptoms? So if patients come in our office and they're thinking or concerned about whether they have scoliosis or not, there's normally 7 symptoms that are most commonly associated with scoliosis. And the first one is a postural change, some kind of change to your posture. Overall body symmetry, you have some type of uneven shoulders, you have uneven hips, uneven waist, you have uneven rib arch, maybe noticing ribs being forward on one side of your body and being back on the other side, uneven legs, uneven arms, uneven spacing between your arms and your torso. Any type of asymmetry is a possibility that there could be some scoliosis occurring. Second tends to be lung function. Sometimes this can be associated in severe scoliosis. You can see lung impairment or shortness of breath, and this is typically most noticeable in physical activity, mostly in physical exertion. Like you're having some type of exertion, you may notice a shortness or windness or shortness of breath. You tend to feel a tightness or the inability to take a big, deep breath in, and this tends to occur because the severity of the scoliosis and the stiffness of the scoliosis going on there, and the actual spacing associated with the ribs when they actually move out of alignment. Thirdly, are you experiencing any kind of back or neck or leg or head pain? A lot of times, unfortunately, with scoliosis, as the curve progresses, it can lead to a compressive problem within the person's spine. As the spine is compressing, especially in adult scoliosis cases, the curve continues to get larger. As it continues to get larger, it can affect the nerves that exit the spine, which can actually lead to pain. It can affect the way the cerebrospinal fluid is actually flowing through the spinal cord, which can actually lead to pain. It can affect discs that can cause them to herniate and can actually bulge, and they can affect the nerves, which can also lead to pain, can cause degeneration in the spine itself. This degeneration can also, unfortunately, lead to pain, and it can lead to stenosis to the holes where the spinal cord go through, which is the spinal canal, and the spinal nerve root holes, or the spinal foramen where the nerves actually exit, which can lead to pain. So all these things, as the curve begins to compress, can lead to neck, back, leg, or any kind of head pain. That can be a sign there. Another sign could be not being able to sleep well. Most common patients can't sleep well. Number one is because they can't just get comfortable in bed, meaning that their asymmetry of their scoliosis in their ribs and hip don't allow them to find a comfortable position. Also, if they're experiencing pain as a result of nerve compression, we know nerve compression tends to be more painful when you try to sleep and rest, because the nerve system can't rest because it's being compressed properly, so you have a hard time sleeping. Also, because the spine can also affect lung impairment, it can affect the way you breathe properly, and this breathing can cause a disrupt in your sleeping patterns. So the pain and the lung impairment can manifest itself into a big trouble or having trouble sleeping. In addition, another problem that can be occurring is that you could be having digestive issues. Digestive issues could be associated with bowel, colon, or digestive problems. A lot of times it can be associated with just the actual size of the torso. As the curve begins to increase, it decreases the length of the torso. The length of the torso actually increases decrease space for the digestive system to function properly, notably the small intestine, the colon, and the stomach. So therefore, all these things get compressed. It causes a sluggish or slower pattern of the digestion. In addition, it can affect the spine and the central nerve system, like we mentioned. And when you affect the central nerve system, you can affect the nerves themselves that control the organs. And when you affect the nerves that are controlling the organs, you can decrease their ability to function properly. And these systems can't function like they're meant to. And one of the big issues is digestion. So we know scoliosis patients tend to have more problems with digestion and bowel movements than an average patient would. In addition, if you're a female, it could be affecting your menstrual cycle. It can cause irregular menstrual cycles because the way the spine or the scoliosis can affect the nerves, and we know once it can affect the nerves, it can affect the organs that they're functioning. Also, there is one theory about scoliosis development that it can cause hormonal issues, or hormonal involvement could be one of the causation of the scoliosis itself. So if you have hormonal concerns that could be causing scoliosis, you can also have hormonal concerns that could be affecting your menstrual cycle. And last thing is this overall balance issues. We know that scoliosis patients can sometimes have balance problems, because especially while they're growing and developing, because they don't have a true center. meaning their nerve system or their body has a loss of proprioception, meaning where the body is in space relative to gravity, because in the shift of scoliosis causes this not knowing what center or straight is to the nerve system, and that uneven forces of gravity on the body can create like a balance problem. A lot of times scoliosis patients can feel clumsy, they can feel disoriented in their balance, and they could have balance issues. Not necessarily true vertigo like spinning, but more like balance issues, like they don't feel very coordinated. But understanding that every single scoliosis case is unique, you don't have to have all 7 of these to say that you do have scoliosis. In fact, some patients have no symptoms associated with scoliosis at all, and all they have is a curve actually occurring. And this is not uncommon for kids that actually have no symptoms at all. As curves tend to progress and as patients get older with their scoliosis, they tend to have more and more symptoms, and it's definitely related to the severity and the person themselves. Typically, the more severe the scoliosis becomes, the more likely it is to cause more of these 7, and the more of these 7 things it causes, the more it can affect your life and your daily life activities. So our recommendation is never let your curve become serious, never let your curve become severe. Be proactive. Treating small curves actually produces a way better outcome than trying to get a large curve and reducing it. If you have a large curve already or a severe curve, definitely you don't want your curve progressing beyond this point. You want to use a corrective approach to try to reduce the scoliosis, to stop the curve from progressing and trying to reduce the amount of the symptoms or things that you're experiencing as a result of the curve. You want to do that as soon as possible, because if it's progressing already, there's no reason to suggest that it's going to stop. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.